5 most important points for lichen planus that you must always remember. Today we see patients across the globe. Cases of lichen planus are going up. In the earlier times before COVID, we used to see lichen planus 2 out of 100. In today's time, post-COVID, we see 40-45 people on a daily basis, patients traveling across the globe for the treatment of lichen planus. These are the 5 important points that patients almost forget, which is why it increases, it spreads further. You must consider, you must know these points to make sure it is cured right from the root cause. Let's understand in this video. Namaste everyone, welcome to Jyovis Hospital of Ayurveda and Aesthetic Center, Mumbai. Lichen planus is an autoimmune skin condition. A lot of itching, raised patches, different areas are affected, a very severe condition. Lichen planus is a chronic stubborn condition. We've spoken about lichen planus and its treatments, its remedies, its diet in many of our videos. In this video, I'm primarily going to focus on these 5 points that patients tend to forget. Number 1, it is the first and foremost point, the touch. If you scratch, if you touch, if you irritate the skin, if you get a scratch or a wound or a bruise, if you get any wound over your skin, remember you're going to develop an area, a patch, a lesion of lichen planus. Most patients feel that if we scratch and if they remove the blood, they will get relief. They do get relief, but that's temporary. You're going to see a lot of new patches or lesions wherever you touch. So if you touch and scratch and itch and irritate, welcome to new lesions of lichen planus. A very important part is there are multiple different treatments. There are immunosuppressants, there are steroids, there are antihistamines, there are multivitamins. On the other side, there is an authentic Ayurveda treatment to make sure we can not just control the itching, but we can also cure it from the root cause. So take help of these remedies, these treatments, these protocols to control the itching. Take the help of antihistamines in case of a severe attack, but make sure you avoid irritating or touching your skin. That's the first point. Number 2 is a very important part, is there are certain food items which can cause an allergy, which can increase the itching. Food items like the peanuts, the brinjal, the dairy items, sour items, items that are stale, anything that's stale, that has a lot of seeds like the tomatoes, brinjal, dairy items, the ground nuts. These are items that are allergic. They are naturally allergic in nature. So we must tend to avoid these food items. That's the second important point. Foods that are allergic, avoid it. A list of food items in the description box. Make sure you go through them and have a look about them. Point number 3, which is very important, that there is no general treatment for lichen planus. Whether it's the hypertrophy lichen planus pigmentosus, oral, sclerosis, planopilaris, these are lichen planuses which have their different characteristics and the different areas that are affected. So there is no general treatment, no A for A, no B for B. Lichen planus is an autoimmune condition and hence the immune system has to be corrected. Some of the pathies, the signs, it decreases the immune system and cures a person. Some sciences increases the immune system and cures the disease. Whichever science you choose, make sure your immune system is modulated and you get healing in such a way that there is no relapse and no reoccurrence at all, for which we need to touch and eliminate the root cause. So it's very important that we follow a specific treatment rather than a general treatment. I've seen a lot of people, Mahamanjishtadi Kwat, Khadir Arishta. Now Khadir is Sarva Kushtahar. It is not going just for the Charma Kushta or the lichen planus, which is, it is related to. So a specific pinpoint treatment is very important for a condition like lichen planus. Fourth point, which is a very different point with regards to lichen planus, is the lichenoid drug eruptions, which most people are unaware of. Lichen planus drug eruption, there's a list of drugs which can react to the body and people develop lichen planus. Post-COVID, COVID vaccine, booster dose, and a lot of dengue medicines, malaria medicines, typhoid medicines. Post these medications, a 3-4 months or a 1 or 2 month patients tend to develop the areas, the lesions of lichen planus, which tells us that drug eruptions are very common. There is a complete research on internet which you get which talks about lichenoid drug eruptions, which you must consider for sure. So go through the list and make sure you avoid those drugs to avoid any kind of interactions in the particular system. Last but not the least is the general cause of any autoimmune disease, which is the emotional stress. If there's a lot of personal emotional stress, if there is a self-blaming emotional stress, we tend to see patches, lesions of lichen planus. So it is said that chintanam chati chintanat rasavainya dushyanti. Rasavah strotas, the first tissue doesn't get the nutrition if you take a lot of stress. Stress will disrupt the rasavah strotas. It will not give any nutrition to the first tissue, and all the other further tissues, they will not get the nourishment, nutrition at all. So it is basically disrupting and disturbing the entire system. So emotional stress, a big no. The moment you realize you're overthinking, make sure you take charge. And stress is equal to the number of hours that you think on the problem. It's your choice. So you make sure that you indulge in good activities, that you have no time for the emotional stress factors. Try your best to be better than what you were yesterday with regards to the mind management as well. So these are the 5 most important points that I want to tell you about lichen planus. Make sure you write it down, make sure you follow, share this video, like this video, write down your views in the comment section below. Until next time, from Jyovis and the team, look impressive, be progressive.